name is Shruti Thomasabipur. I think many of you know me already, but I am the Executive Director for the Wachusett Area Social Justice Alliance. And I'm also a diversity, equity, inclusion, and belonging consultant. And I live in the Wachusett area community, but obviously our community extends beyond us. It's all through Central Mass, and frankly, we're all interconnected as far as we're concerned. And we really wanted to take this opportunity during Black History Month. Frankly, this should be happening much more regularly. And really, I believe Black History Month should be much more about celebration than to kind of talk about the things that we should be talking about all the time, because there's such pivotal issues in our communities that we all see and feel so helpless about. But we really believe that this was a tremendous opportunity to bring some experts in the area and have a really candid conversation about the discrimination and racism that is so structural and so much a part of kind of the everyday experiences of people of color, people from diverse backgrounds, immigrants, people who speak different languages, but certainly statistically, the Black community and the African American community are some of the worst treated people, frankly, by our healthcare system. And in order to kind of address some of these issues, I thought it was important to invite people from the entire diaspora of the healthcare field. And we are so lucky to have found some unbelievable folks who are willing to put their time in to educate us and to talk to us about some of the disparities they see, and also to teach us how to kind of step up and intervene when the time is right, and how to do it with grace, but to do it whenever humanly possible. So without further ado, I'm going to go through and introduce just your names, but I'm going to introduce you by name and then have you all unmute and introduce yourself, talk about how long you've been in the healthcare field, what your experience is, and you know where you're speaking to us from. So I'll start with Dr. Tony Esalan. Am I saying it right? Esalan? Okay, I want to make sure.
Esalan, yeah.
Thank you and welcome.
Yeah, thank you so much for the invite. Hi, everybody. My name, like she said, is Tony Esalan. I am an internist and pediatrician. I'm MedPeds trained, and a specialist in global health and health equity. I am currently working at City Block Health, which is a health tech company startup that is using digital platforms to provide care to Medicaid and low-income Medicare patients. And yeah, well, we're working out of New York at the moment. We have a couple of sites in Brooklyn. We're opening up in Queens, also in Nassau for New York. And we have a bunch of other places in Mass and Connecticut and DC and now North Carolina. So we're expanding and just happy to be here. Thank you for the invite.
Thank you so much for being here. And I definitely want to hear more about the organization because it sounds incredible. But thank you. Welcome. Chief, I will throw it over to you if you don't mind introducing yourself.
Sure. My traditional name is Sikwan Paijeke, which means Spring Buffalo. My government name is Chief George Spring Buffalo. I'm the chief and head counsel of the Wachusett Wampanoag tribe of the Pocono Nation on the Watuppa Reservation in Fall River. I'm a direct descendant of Massasoit, which is Yellow Feather and Mattacomic King Philip. And we also have a nonprofit land trust, which we're out of Massachusetts and Rhode Island. That's where our territorial lands are. I'm coming to you from Turtle Island. So basically, I'm here as a participant for Indigenous communities, and I do a lot of advocacy for healthcare, as well as introducing people to services of what their rights are. Welcome, I hope.
Thank you. Welcome. Thank you so much. Rosa, can I throw it over to you?
Most certainly. Good evening, everyone. My name is Rosa Fernandez. I'm the Director of Community Health and Volunteer Services at UMass Memorial Health Alliance Clinton Hospital. Yes, it's a mouthful. And I'm delighted to be here tonight to share some of my own experience and ways to advocate for your respected clients and especially folks in most vulnerable populations are people of color and Indigenous and also our immigrants and just to name a few. But also I also want to honor those before us who have made stride. Because this is Black History Month, so we really should celebrate those who have led the path and pave our ways to continue to advocate for our most needed population, our most affected, the most isolated, the most not appreciated and cared for the way we should be doing with dignity and respect. So I really want to honor those before us tonight and I'm looking forward to more of these discussions. Thank you.
So much, Rosa. And I echo your sentiment. Hopefully this is the first of many conversations around these issues and candid conversations, more important than anything else, I think, in this day and age. Irene.
Hello, everyone. My name is Irene Herba Hernandez Guzman, or Bibi Mukaru, which is my native name in Taino, which means Mother Eagle. But I'm coming to these conversations. I always get excited because we get to honor our ancestors. We get to honor those who created the space for us today. And we get to talk about we get to have these difficult conversations so we can shift the narrative and interrupt it as many times as possible. And I was in a meeting earlier today and I said, look, we're going to keep doing this until we're blue or black or green or yellow or whatever color you want to say we are in the face. Because, we're exhausted, but it doesn't mean that our work is done. As we've known, this has been happening for over 400 years. Some things have shifted, but the storyline and that false narrative continues to perpetuate itself in subjugation, oppression, and violence against people of color. So I'm here. I wish others were here as well to have these conversations because they get to hear from us. They get to hear our stories. They get to hear what the health system and what healthcare looks like for us and the inequities in it. I don't want equality. I want equity. And that's why I'm here. And I'm the director of an adult day health center in Fitchburg that is polylingual and polycultural. Thank you.
Thank you, Irene. Irene's also been unbelievably helpful in, frankly, finding the best people for this panel and really kind of making sure that I've been accountable, right, as we've gone through this process of developing what this is going to look like and moving it forward. So thank you. Francisco?
Francisco Ramos. I am the Director of Community Organizing with New View Communities in Fitchburg, Community Development Corporation that serves the North Central region in the state, in the county. And I'm happy to be here.
Thank you, Francisco. Let's see, who am I missing here? Everyone keeps moving around on me. Sorry. April and Chelsea.
I'm April Maldonado, and I work for City Black Health, and I work in the Massachusetts area. We cover Fitchburg, Leominster, North Central, and Worcester, Mass. So it's an amazing company that really focuses on bringing people together and really breaking the barriers. So thanks for having me.
Thank you, April. Chelsea?
I'm Chelsea Patrice. I'm the Executive Director of China 9, which is the Community Health Network for North Central Mass. We're the Health Equity Coalition for the North Central region, serving 27 cities and towns. And so I get to come at this from the perspective of public health and community health. You don't want me in a clinical setting, I promise you that. And so we get to come at this from the perspective of what does the health system look like when we in public health want to make equity happen, and we have to deal with the long history of mistrust and disenfranchisement that that is essentially preventing us from the good intentions that we have now, and how do we reconcile those that history with our current intentions, and how do we see how those inequities still play out in our health systems, and then how do we when we see this as white folks, how do we engage in allyship and active bystandership in positive ways?
That's a great segue to kind of the opening question, which is for you all, both are honored experts, and as well as frankly anyone in this group. It's a small group, but I think it makes it kind of that much more quaint for us to be able to have this conversation. Can you talk about what brought this issue home for you? Is there an experience that you can refer to that was kind of the wake-up call about why this area of, frankly, racism and socioeconomic disparity is so blatant and so often overlooked? Can you talk about what kind of highlighted that for you the first time around? And we can start from, if you don't mind, Dr. Tony, if we can start with you. You're the furthest person away. So
I don't mind at all. I don't mind at all. I think for me, being a Black woman in America, there was not a moment. It's just been my experience the whole way through. I think that if I'm reflective to answer your question, if I'm like, I would say that the first time it hit home was my father passed away because this system is racist, I lost him at a young age. He was 52 years old. And had he not been a Black man, in my opinion, he wouldn't have suffered as much as he did. And he wouldn't have made the decisions that led up to his suffering as he did. I think I didn't get a chance to intervene. I was in medical school when he passed away. And so I hadn't gotten a chance to learn everything that I wanted to learn to help him navigate this horrifying system. That stuck with me. That definitely stuck with me. And then actually, as I passed through my education, it came more and more obvious what the issues were. I think the part that hurt me the most was when that study, it just came out in 2016, that study that came out about pain management and how medical students believe that Black people do not suffer pain the same as white people. I was like, oh, that's what killed my father, because he had an open heart surgery from a congenital heart problem, and his pain wasn't managed. And so when he needed to have another surgery, he said no. He said no, and that would have saved his life. And that's what's really painful about that. That was a preventable death. And systemic racism, participated in that. I think that as a physician, how I've seen it, I have dozens and dozens of cases, but one that I like to talk about because it just brings it home. If anybody's heard me talk about it, I apologize if it's a repeat, but I was an attending in Miami, Florida, at the hospital that I was working in. And a 60-year-old Black male came into our clinic who wasn't feeling great that day. And he was having, he was dizzy and just not feeling great. He was having a lot of urination, feeling really thirsty. We checked the blood sugar. Blood sugar's off the charts. He had a history of hypertension and hepatitis C. We basically were like, oh man, you have diabetes, right? Like this was his first time hearing that he had diabetes. It was off the charts. So we sent him to the emergency room with a diagnosis of new onset diabetes. Like I wrote a note and I said, new onset diabetes. And when I went to go look up the records to see how he was doing, right? Like, he was admitted. I went to look up the records, the ER note, uncontrolled diabetes, risk factor, non-compliance. And I was like, what? What do you mean? Then I look at the admission note, and the admission note says, uncontrolled diabetes secondary to non-compliance. And the reason why this is so horrifying and such a tragedy is because he was discharged with instructions of a non-compliant diabetic, not as a new onset diabetic. Don't get me started on the word non-compliance. That's going to be a whole nother like monologue. but that's a demonstration, first of all, of how useless that term is. And then second of all, like you just associated Black hypertension, diabetes, non-compliance. Like that's what you did. You just went through that process as opposed to reading the note from the PCP that said that the patient was a new onset diabetic. Like that could actually hurt him. He doesn't know how to use the medications. He doesn't understand the medications because he's being talked to as if he knows already. And so I don't know, I got muted all of a sudden. So I guess you want me to stop? I will stop. That's okay. I said it.
Keep preaching, preach on, sister.
I apologize. Keep going. Keep going.
Oh, no, I thought my time was up. I'm sorry.
No, not at all. It muted me and you for whatever reason.
I think that story tells it all for me. I have dozens of cases like that, like of stories like that, unfortunately. But that's how racism plays out in these systems, right? It's not a I'm not going to take care of you because you're Black. That's not what happens. What happens is, you know what? I think this, so I'm going to give you that. Or I think this, so therefore I'm going to tell you that. That's how it actually plays out.
The thing that's so upsetting about what you just said is, here's someone that's been diagnosed with something that's terrifying, right? I mean, any new disease diagnosis for anyone, certainly a person in their early 50s, is jarring. So to go from that to non-compliance tells you how messed up the system is, right? Rather than kind of saying, let's ease you into this new diagnosis and make you have all the tools you need to be able to treat it. The assumption was that he was probably lying about not knowing it before. And here you are, The other thing I was going to mention that you brought up, I mean, one of the pieces that I do in my implicit bias training is, people assume that first-year medical students are so smart because they got into medical school. And it's so we really give that hierarchy so much weight. And the reality is that study that you're referring to was a study done of first-year medical students and pain management, and their assumption that Black people don't experience pain to the extent that white people do. And it really kind of makes you question what our notions of intellect is and the hierarchy we place on people in certain schools or advanced schools, because it means nothing.
I think just to go on that point, I don't think it's about intellect. It's about exposure to information and how you're exposed to that information. I mean, medical students learned that from somebody. Yes. Somebody taught them that.
That's right.
That they got that from, somebody who taught them that in the past. And so I think that these things get perpetuated as fact. They just get perpetuated as fact. And it's just a reflection for me. It's just a reflection of how embedded the systems are. People have to remember, like, these systems, like, how is it possible that we can escape racism when the country was born out of it? It was born out of racism. There's no way that there's nothing racist about America. There's no way. And that's not an unpatriotic statement. It's just fact. It's just what it is. And I think that, the only way to wrangle this and to address it and to fix disparities is to stop being ahistorical and recognize where we've come from so that we can rectify all of those injustices.
And it's so hard for people to talk about history, right? I think it is such a difficult topic of conversation for so many people. Thank you. What a great way to start this conversation. Depressing, but great in so many ways. I'm going to just pass it on to whoever wants to take it from there.
I would like to add next, please.
Yes.
So my experience, I've had many, just as the doctor has said, right? Because we, especially in the Afro-Latino communities and people of color communities, there's always a spokesperson. And so we've had to like communicate in different languages for our elders. And then they start screaming at them because, oh, you don't hear me. And it's like, no, they don't understand you. There's two different things. And then fast forward to 2015, I'm at a Massachusetts Commission of the Status of Women meeting, and my daughter calls me and she's like, Mom, I'm bleeding. And she's 9 months pregnant. I said, well, take the ambulance and I'll meet you there at the hospital. She gets to the hospital. She's having a placenta abruption. So as she's having the placenta abruption, the doctor, they haul her off to the maternity room, and my daughter, they call me and they said, hey, we have to bring her into surgery, blah, blah, blah. I said, okay, I'll be right there. So she goes into surgery. I'm running in there, and everything came out fine. The baby was delivered alive. They were stitching up my daughter, and the doctor was talking to me. So I said, okay, she's going to rest. I'll be back later. About 20 minutes later, I'm back in another town 20 minutes away, and they call me and they said, oh, Ms. Hernandez, your daughter's hemorrhaging right now, and we have to give her blood transfusion. And I'm like, what are you talking about? So I made it like in 4 minutes, and I'm in there. My daughter's lips are like this big. Her body is ashen. She's gray. She's leaving her body, and it just hurt my heart so bad. And the doctor's standing there, and the nurse, they're looking at me like, oh, yeah, she's hemorrhaging, like it's not a big deal. And I was like, what are you doing? Get her into the emergency room right now, give her blood, and stitch her up, because the doctor had forgotten, listen to this, to stitch her up after she was hemorrhaging. So we delivered the baby, so it was negligence on behalf of the doctor. So what did the doctor do? She said to my daughter, yeah, we're going to have to check your placenta blood and the baby's for crack, because that's what usually happens with you people, right? So you see an Afro-Latina, and then she's been followed in this hospital her whole life, right? So they have all her records, never once even smoked a cigarette, but now she's a crackhead, right? So she's equating her negligence to my daughter being a crackhead, and that's why she had a placenta abruption. That's what she's equating, right? They called DCF, right? So they invited the Department of Children and Family without no evidence of anything happening, right? My daughter's hemorrhaging. They're watching her. And I told the doctor, how can you forget to stitch her up? And how can you forget that she was... I'm sorry, can you hear me?
Yes.
The nurse was very... So the nurse didn't know who I was. And she shouldn't know who I am, because it doesn't matter, because my daughter should have had equity anyways. So the nurse starts treating me like, oh, you're upsetting her. You need to go. I said, I don't need to go no damn where. My daughter wants me here. I'm going to stay right here. And my daughter's like, you let my mother stay. But they were trying to get me out as to not see and assess the situation that was happening. Anyway, make a long story short, we filed a grievance. As we're filing a grievance with the hospital, the lady who's taking my grievance is changing the narrative. She's completely changed it. She's like, oh, so you felt. I said, no, I did not feel. I want you to write what I said. This doctor said that my daughter was a crackhead, and that's the reason why she had a placenta abruption and she was hemorrhaging. Not that this doctor forgot to patch her up after she removed the baby from my daughter. I want that written clearly. Also, you feel. I said, I don't feel anything about this doctor. What I'm telling you is that her negligence, and then trying to say and equate it to my daughter being a crackhead and calling DCF, I want this in the records. And so the whole process was so disturbing, and it just really, it made my blood boil. But I'm like, how many of us have to die, right? How many of us have to die for negligence because we don't feel pain, right? And my daughter doesn't even with her C-section, she's never taken a narcotic because she knows that's how a lot of our people get stuck in these systems, right? So she'll ask for Motrin. This is my daughter. And then this doctor, who is Caucasian, was saying that my daughter was a crackhead because she was an Afro-Latina. My daughter was hemorrhaging to death because she was an Afro-Latina. That's the truth. Because if my daughter would have been little Mary, and Mary's scared, right? And right away you see that Mary's crying, and Mary's white, and oh my goodness, we're going to help you, we're going to save your life. Don't worry about it, we have you. There's a different care for Mary than it is for Sheree, my daughter. There was, and I've seen it, and I've seen it many times throughout the years. And it's exhausting. It makes you want to throw up. And it's just like, man, this system that they created for us, we get to dismantle it. And that's why we're having these conversations. I have them everywhere because it gets to shift. It gets to shift. We're smart, intelligent people, and we get to have equity. I don't want equality. Equality was that they took the baby out my daughter and they treated her. But the equity is that my daughter, the equality almost cost my daughter her life. Equity would have never been called into question had my daughter been Caucasian.
Wow.
I have something I want to share. So my father's 93, thank God. He's pretty healthy otherwise. He was in the hospital like 2 years ago. And I'll never forget, we forget how being elderly and African-American and how you're treated in the hospitals. So he's elderly, so they're treating him as though he doesn't understand anything. He has all his faculties, he's fine. But just to see how he declined being a week in the hospital, once we got him out, he did better. And put him in a rehab. Now that says a lot. The hospital's supposed to make you better, but they had lost his clothes, they left him in the bathroom by himself. And thank goodness I was there. You know, I'm just thinking he was not stable enough to walk on his own. He needed help. And I think that would have happened to somebody else. You know, they just kind of left him. And just the treating him like a baby. And it was just such a disrespect. He's a military man. He retired in the military, very strong personality. But I just seen him decline. I think sometimes the elderly of color gets lost because I really feel like sometimes they don't always have a voice, and I got to feel what that feel like watching them, how they treated my dad. So just that experience, I think sometimes go under the radar, you know, as we get older. It just makes you think like, what will our treatment be like in the future? Yeah. Thanks.
I mean, I think this is why it's so urgent, right? I mean, this is why you can't do the same thing the same way and expect different results. And we have to shake things up. And even if it means it offends some people to have these very blunt conversations, we just need to start having them. Thank you. Thank you for sharing that.
I like to speak on the Indigenous aspect of things. I had a aunt, bless her soul, and she was in a nursing home. And I'm a Black Indian. And you look at me and you see a Black person, but I'm not a Black person. I identify myself as American Indian, who I am. And when she was in a nursing home, we are talking about cultural responsibility. So if she's passing, then there's a tradition that we have. Sage is one thing. So because we do blessings with sage, and then there's an issue through the nurses or the administration about us saging, we had to educate them on Native rights. And just like you have a priest come in and you do blessings with Christians and so on, or you have a rabbi come in, you're having our cultural aspects of our spiritual being come in and do the same blessing. And just because it's different things doesn't make a difference. So in one sense, yes, I could get upset about the confrontation, or they look at it as confrontation. I don't. I look at it as education. Then yes, some person could get upset. But to me, it's an opportunity to educate people so that they can pass that through the medical fields, as well as I'm at the table at the hospital or at the clinic I'm also at the table at the DMH office, or so on and so on. And the other thing is mental health. When we have crises in our culture of mental health, you can't treat our kids and our adults and our elders the same way as what you do with other cultures, because we have traditions. And our cultural tradition is on a federal status. And that's why we have separate issues from people of color. And I say that as people put us in the people of color box, but we're not people of color. We're Native American, we're American Indian, and we're Indigenous. So that when people want to self-identify themselves, just like people don't realize that 70% of Puerto Ricans identify themselves as Taino Indians. And that's on the census. And people identify you as American Indian or Native American. Native Americans are federally recognized tribes because now you fall under the United States Trust. I'm an American Indian. I'm an Aboriginal. I come from the original aspects. I don't come from federal tribe. I'm also urban Indian because I live in urban communities, not on a reservation. I have a reservation, but I don't live on that reservation. So when you're talking about disparities of healthcare and poverty and so on, you have statistics that's according to the federal government and the state with reservations statistics, but you don't look at the urban aspects unless it's time for elections, and then they want to come into your communities and state tribes and get them votes. And that's how we also get our needs met, because 70% of us are urban Indians. And if you want our votes now, then you got to come through leadership and say, what are you doing for us outside of federal benefits, which are still entitled to us through American Indians? So I'm just saying them disparities that are there is that we fit in the people of color box, but there's dollars that are available to our communities that a lot of our people in leadership don't even know, even through the PPP money and so on, that are there for American Indians. And if you look at any application from the census down, you don't see Native American. You see federally recognized tribes, American Indians, Native American Alaskans. They don't say Native Americans because that's not federal dollars that was supposed to be given to us since 1621, when we first started being discriminated, when we signed that treaty with the Pilgrims. So that's where I'm at. This is my daughter, by the way. She's in the social work.
Welcome. Thank you so much. And thank you, frankly, for educating so many of us that might not necessarily know the breakdown. I think this is the piece of it, right? Is you can try and be as aware as possible, but the reality is that you almost need to be able to kind of focus in when you're talking about these issues and really kind of educate yourself beyond what is out there, even for the most progressive people. So thank you. Anyone else want to jump in?
So I'll share. First I want to, I always feel like I need to apologize to people when I hear stories like this, because I work for the healthcare system, the system that really disrupts people's lives, especially in most disadvantaged communities. So I always have that need or that feeling when I hear these stories, because I work in the system. But I want to point out that it's not certain individuals, but it's the system. It's the system that the structure that is put in place that continues to perpetuate and people, and dismantle. We need to start to dismantle the systems that are in place that really hurt people. Because some folks get into the field because they want to help people. So I didn't want it to discredit every individual within the organizations, because there's some compassionate folks that that treat people because they want to have the best outcome for individuals. But I do agree with a lot of you that we do have a messed up system, and there's a lot that we need to improve. And as Irene said, this has been going on for over 400 years, and still we have, it's kind of sad that we're still having these conversations, if you ask me. But from my own personal experience, when I realized that I wanted to get into health equity work and racial justice work was when I was a teenager. I grew up in housing development, you know, where people were impoverished. So that was my first kind of encounter of the reality of we are not equal. And this is where I experienced my inequities and trauma, microaggression, and has lived on with me in the advocacy and the work that I do now. So growing up in an area like that, you see all kinds of things. You see drug dealing, you see domestic violence, mental health. The list goes on and on. No access to healthcare, or folks just trying to meet ends, or just trying to feed their families, and healthcare is like the last thing on their list to worry about, because they need to sustain their family and their living, and they need to eat and survive. So healthcare happens to be like the last thing you worry about. So the chronic illnesses kind of increase in neighborhoods, impoverished neighborhoods like the one that I grew up in. And I recall being a teenager, and even my peers were either getting killed to teen violence, or they were going into jail because the opportunities weren't there. The school system, the criminal justice system, the healthcare system, all these systems totally destroyed the families that live in these neighborhoods. And so that was my first encounter when I realized how behind we were compared to the rest, compared to our white counterparts. So it starts, well, as a child, the infant immortality was higher in Blacks than in whites. Just the chronic illnesses, the life expectancy was shorter for families that live in these areas, these impoverished areas. So research showed that if you weren't exceeding economically, if you weren't doing good economically, or you weren't living in an area that was more accomplished, your health outcomes were going to be poorer than the rest. And so, and that kind of, it's like social determinants of your health, like the conditions and the places and the social support system that you have in place will determine your health outcome. So you could just imagine a very impoverished place with lack of support system, with lack of economic, lack of education, lack of just created more barriers for folks living in areas such as housing developments. Even the development is very oppressive. You know, they make our folks believe that, oh, well, you live in a home, you have a shelter, and at a less cost, but it kind of like set people back thinking, believing that I'm being taken care of. And it kind of puts our folks like stuck there instead of trying to achieve or trying to find the tools to help them advance themselves. Because if they've advanced themselves, again, they'll have a better health outcome. And so a lot of these systems are like set up to make our folks fail. And that was one of the things that was an eye-opener to me, because I see my peers, I didn't see them advancing. I seen them going to jail. I seen them going into all these areas where they weren't achieving their greatest quality of life. So for me, my first experience was just living in an impoverished area where access to healthcare was 0 to none, and having to be brought up in a Latino family, Indigenous, Taino. We also identify ourselves as Taino. Language was another barrier. I remember being a kid interpreting for my parents, and in these settings, and sometimes as a kid it's pretty intimidating to interpret things that are pretty private about your parents. And so I learned at a young age how to advocate for people of color, because I seen the injustices even for my parents when they couldn't even access their healthcare information in the language that they preferred, or that it was their primary language. I know there are laws now in place. However, we're still far from perfect with people's rights to an interpreter, or people's rights to have their health information in their preferred language. So I hope tonight is just a tip of our conversation of how to improve these systems, because we're still far. I'll be honest, and because we're having honest conversation here, we're still far from it. But we need to continue to educate others on advocating for these policies to be updated. And I say updated to really address the needs of our communities.
Well, and also, I think you bring up such an important point as also an immigrant who was the interpreter for my parents every time we went anywhere. And to this day, I mean, they speak English fine, but it feels like if I'm there, suddenly they only speak to me, right? Because I don't have an accent. And I feel like these experiences are so raw, because you watch people that you care about get treated with such disrespect. And suddenly all their privacy rights don't matter anymore, right? It doesn't matter that they were trying to say something confidentially or quietly, because it's something that they don't talk about generally with anyone. So now they're with their healthcare provider, and they're embarrassed, or whatever the cultural issues are, and the healthcare provider doesn't make eye contact with them. Or you go into the emergency room and they speak louder to your parent because they have an accent, or they go to the bottom of the list because someone that speaks English was also there, and getting an interpreter is an afterthought for that other person, that's even though they were there first. So all of these kind of microaggressions, right? The death by 1,000 cuts, where you don't trust the system anymore, very, very much become part of your narrative as an immigrant, as someone who's considered as other. And what really kind of strikes me, obviously we've hit the over 500,000 mark on deaths from COVID, and the number of African Americans and people of color and immigrants who frankly were sacrificed at the altar of COVID, in part because they weren't prioritized, even though they may have been there first, because of an interpreter, because of other issues, because they didn't have an advocate there, or someone dehumanized them. I think to me anyway, this last year has been really jarring because you just watch people, it's like they didn't matter.
The sad thing is that folks of color have I want to say some trust the system. They trust their doctors. They trust that they're going to get the best care. And that's the sad part, is that they're coming into these institutions, putting all their trust on their doctors and the medical providers, not realizing that they might not be getting the fullest quality of care that they deserve.
Yeah.
So
I know that, and talking about the vaccine and acquisition, they moved it from the local area where the marginalized, where the Black and brown people are, and they moved it like an hour and a half away to a richer, more affluent area. Then the vaccines that are locally, what's happening is that they're calling one another. They're not even calling our communities, our Black and brown communities, to come and get the vaccine. They're calling one another, and they're stepping. So because of privilege, or white privilege, they're pushing aside their turn, and I'm here right now, so take care of me. And then we have this whole group of people that have no way of getting to this place an hour and a half away to get the vaccine. It's here in your town, but because you don't know someone, you're not getting vaccinated. And then the flip side of that is that people who don't trust the vaccination because of all the misinformation and the propaganda that's behind, Pfizer, Moderna, and Johnson & Johnson, and this whole conspiracy theory behind it. And so I think I wanted to ask the doctor about that, if she could speak on that, because I know that's a huge issue as well for our Black and brown communities. And, we're talking about Black history, we get to talk about, what happened with that distrust throughout, all these experimentations and sterilization of the Black and brown people. And then here we are, boom, with COVID. And what do we do with it, Dr. Tony?
Awesome question, and a loaded question. I will answer with telling you my story around the vaccine. Like I said, I'm a doctor. I have a medical degree. I also have a PhD. And so I've done research. I know what research looks like. I've studied both kids and adults. I'm both a pediatrician and an internist. And when the news of this vaccine came out, I'm not going to lie, I was like, oh, hell no. I was like, oh, hell no. I told all my family, I was like, don't let them put that poison in you. I was like, no. Oh, hell no. I know science. It doesn't take 4 seconds to make a vaccine like this, right? And I actually joined some conversations about vaccine distribution. So a lot of organizing communities immediately jumped on distribution as going to be an inequitable process. For me, I was just like, I wasn't even in distribution, because I was just like, you've got to convince me this is safe. I can't even go to the distribution route because I don't even know if it's safe. I can't even tell my mother what to do, right? And so I was struggling. Honestly, I was struggling as a person who's a physician in the system. I did not know what to tell my mom. Now, remember, I already lost my father to the system. I wasn't going to lose my mom to the system. My child, I have a 3-year-old. I don't want him to get hurt. No parent wants them to get hurt. And so I was struggling with this a lot. And so I sat down and I was like, you know what? All right, this thing is coming. There's nothing I can do about it. It's coming down the pike. What I need to do is learn. I need to learn it. I need to understand it so that I can talk about it and talk about it authentically. And so I sat down and I made a PowerPoint to convince myself of what I was going to say to my family, right? And I read everything. I took a week off from work to do this. I took a week off from work. I read everything I could, because I was like, I can't answer the question. I can't even engage in conversations about, are you going to take it? Are you not going to take it? Because I was like, I don't know enough. I don't know enough to say that I'm not one of those bandwagon medicine physicians, right? I actually, I'm my family, I'm Haitian. So I have a Taino lineage too. you know, we believe in other methods, right? We believe in spirit. We believe in natural, right? Like I don't knock that just because I'm a Western physician. I don't knock it. I believe in it. I believe in it. Because the mind is powerful. Now, I think medicines are helpful. I think that there are times to tap into medicine, do you know? But like, if you truly believe that something else is going to help you, you know, like I know how to negotiate around these issues, right? And I think that we don't do a good job of doing that. So I sat down and I was just like, all right, like what's going on? Let me just think about, like, let me just read it all and like read every paper and understand everything, right? And I know that I have the tools to do that because I was trained in the system. And I said, if I can understand it, then I can break it down and I can explain it to other folks. And I want to let you know that I sat down with the skeptical eye. Like I sat down and I wrote this PowerPoint together because I wanted to prove to everybody why I shouldn't take it. That was the goal. And after I was done, I was like, all right, I'll take it. You know, this was back in November. I did this in November. And what I did was that I took the presentation and I actually presented it to my family so that they would, because nobody knew what to do. And so I sat down and I gave it to my family. Like I gave it to my friends and my family, probably like over a weekend, and just had like conversations. I have a bunch of anti-vaxxers in my family. I have a bunch of, you know, folks like, and I wanted to talk, I wanted to have a conversation. I wanted to have a sit down and really talk about like, listen, nobody's going to take, to your question, Irene, nobody's going to take, who's mistrusting the system, any vaccine until we talk about vaccines. Like we can't even go to COVID-19 because we haven't even talked about MMR. We haven't even talked about the flu shot. Like how can anybody actually understand COVID-19 vaccination if we don't even understand what we're giving to our children, right? And so that's how I start. That's how I framed the education around this. And that's how I speak about this. I don't actually speak, you know, I know a lot of my colleagues are like on social media and are talking about like, you have to get the vaccine, and they take a picture and that's awesome. And that's great. And if that's what you think is going to help, I'm all for it, if that's what you feel comfortable with. But I'm actually trying to undo the mess that has been created. And in order to do that, it's going to take commitment, and it's going to take patience. And it's going to be like, I don't feel the anxiety around vaccinating folks, because I feel like, listen, for them, the vaccine is just as bad as getting sick. And so let's just start over. Let's start from the beginning. Let's apologize. Do you know, like, let's ask for forgiveness for the fact that we have jacked up the system and that it is not a trustworthy system. There's nothing trustworthy about healthcare right now. There's nobody who can tell me anything different. And I work in healthcare. I'm an advocate. I'm a healthcare advocate. And I believe in medication. I believe in science. And I know we haven't done it right. But nobody stands up and says that. So why is it that people are vaccine hesitant? Why? Well, let's go back and talk about, like, when did this whole thing start? Let's start from smallpox. You know, let's take it all the way back, you know, and talk about what the process is, what the science is, and what it looks like. You know, and that's what I did with my presentation, is I took it back to smallpox. And I talked about, I don't know if you guys know, but one of the things that I found in doing my work was that, like, first of all, vaccination isn't new. This is something that people have been doing since the beginning of time, especially in Africa. And that they were taking pustules of smallpox and rubbing it into themselves to protect themselves from smallpox. Nobody knows that. And so even our Black community doesn't know that. And so if we can tell them, like, look, this isn't new. This isn't some made up thing in the back of a lab, right? This is a process, because human beings have been trying to protect themselves from the environment and the elements that are fatal since the beginning. Everybody's trying to survive. Everybody's trying to survive, and you try to find out ways to survive. We drink, you know, Haitians love their teas. We do it because we're trying to survive, do you know? And so giving that context is important, and explaining the fact that, and one of the points that I make about the vaccination hesitancy issue is that Why don't we talk about vaccine hesitancy, but we don't talk about the fact that in the Lancet, a research paper came out stating that MMR caused autism. That's where this comes from. This didn't get pulled out of a conspiracy hat. Like somebody wasn't bored one day watching TV and saying, I'm going to make a conspiracy against vaccinations. Like there was a scientific study published in a very prominent and prestigious journal that said MMR causes autism. But we don't talk about that. And the fact that that didn't get retracted until 12 years later. Come on. Of course people think vaccines cause autism. They're not going to give their kid that thing. I get it. And so how are we going to help people get over mistrust? We got to start from ground zero. We have to start over. And we have to say, talk to me. Talk to me about what you're thinking. Tell me what you're scared about. Let's talk about the side effects. And that's what I did in my presentation. I was just like, all right, let's talk about everything that scares you to death. Okay. Let's talk about seizures. Let's talk about why they happen. Let's talk about Guillain-Barré. Let's talk about why that happens. Let's talk about death. Let's talk about why that happens. Let's talk about it. Because every single decision that you make in healthcare, and this is how I approach all of my patients, is you need to understand what are the risks, what are the benefits, and what are the alternatives for every decision that you make. And if you make those decisions that way, if you make your decision that way, if you decide after everything that I've told you that you still don't want to take the vaccine, that's fine. Be at peace with that decision. Don't say, oh, if I had known X, I would have taken the vaccine. Then I feel like I failed. But if you can say, I understand that if I go out there, I can get COVID and die. I also understand that there are uncertainties with this vaccine, and I'm willing to take my chance getting COVID. You're saying that lucidly. Okay, then don't be upset. Do you know? If you get COVID, right? Like you have to, you're going to be upset because you're a human being. But I'm saying that like, understand that like you've made a decision with all of the information that was there, not misinformation, not the stuff that confuses you out of doing good things for yourself and confuses you out of doing bad things for yourself, right? Like this is the information as honest as I can present it to you. And I think that's how you.
And I think one of the things I just want to kind of interject here is that, you know, when you talk about the history and the lack of trust, I mean, you also have to think about the fact that there were so many experiments done on people of color, but whether it was the history of gynecology, or if you think about the experimentation on prisoners of color in the history of America, or the forced sterilization that happened in the factories for people, for again, women of color who had to choose between having a job or having children someday.
Our government went to the islands, to the Caribbean, to sterilize the women against their will. The American government.
This is happening here. And, you know, we think we're so progressive, and this is the history of America. So when you talk about that mistrust that is happening to this day, interestingly enough, and I want to make sure that Chelsea chimes in as well, because she brings up a point in the comment section. It was so interesting to me that when the vaccine first came out and there was all this lack of trust, and then, you know, they were talking about experimenting again. You know, maybe we open it up to the prison population to maybe kind of test the waters there. And then they pulled back and they started actually saying, well, no, we're not going to give it to the prisoners first. We'll give it maybe to the guards if they, right? And so, you know, when it started to get a little credibility, they suddenly went from not wanting to experiment on the most vulnerable populations in our community. So this trust has such a history, or this lack of trust has such a history. I know Chelsea, and then I know Chief, you wanted to bring up something as well.
Well, I don't want to like derail into other systems issues, but it did just make me think about, you know, the way that we talk about the criminal justice system, and we try to say like, oh, well, there's some bad apples, or there's here and there's things that happen, but overall it's, you know, a good system. And we can't talk about our systems, any of them, without acknowledging the truth of the fact that they do not always work the way they're supposed to work, that there are serious inequities in those systems, and that we have not done an adequate job of attempting to root out those inequities. So really, why should anybody trust those systems? And then we were talking earlier about like medical school, and it just made me think of, people are trained in their medical schools and in their programs to have answers, right? They're trained to diagnose and to have something that they can tell you. So they're trained in biology and medicine, and it is only now that it's starting to be a requirement that they also get trained in things like cultural humility and equity in systems, and actually understanding the human side of the people that you're dealing with. Like, we're no longer in an age where doctor says, therefore I do, and we don't ask questions, or like patient-centered care is a fairly new thing for Western medicine. It's not a new thing in other cultures, but it's a new thing in Western medicine. And so, like, having cultural humility at the center of, you don't have to, I think this is where it came from, was when, Sudi, you were talking about really having a deep understanding of other cultures and their approaches to healthcare. And honestly, you could spend your whole life trying to understand every person's and every culture's approach to healthcare, and you're not going to get there. But you have to approach it with an open mind. You have to come at it with that, I don't have all the answers, and I have to listen to you. And that this is a partnership, and that we have to work together, and I have to respect you as an equal and as a person, and not just as I know what I'm doing because I am the Western medicine doctor, and that we need to get to that place where we're treating people as humans and equals. And I think, I'm sorry, I had one more quick point, and then we'll go to Chief. And as we're teaching people that, and Rosa made a great point about that there are people who have that perspective, who got into this because they want to help people. But you enter into a system where that is not how you're evaluated, right? You're evaluated on how quickly, on a checklist of things that you are going through. You're evaluated on whether you did the correct screenings, and whether you prescribed X, and whether you signed filled out all the paperwork, until evaluations are about how did the person feel about their interaction with you, and are they going to come back, or are they traumatized from this situation? Did they understand what you told them to do, and are they capable of carrying out the instructions that you gave them? If you don't know their living situation, and you don't know their competency and their family situation, you don't even know if what you scribbled on that piece of paper is something that they can do.
It's I think, most of you know, I was a public defender for 20 years before I changed careers. And one of the things that would always drive me bonkers, and I think that it is so prevalent in any one of these situations where you have an attorney-client relationship or a physician-patient relationship, is the hierarchy in the relationship. And this notion that because you're a professional, that somehow you know best what I should do, rather than empowering you to make the right decision for yourself. And really the goal of all of these experts and all of these professionals should be to give everyone the tools that they need to make the right decision for themselves within their family context. Whether you're a lawyer or whether you're a doctor, it really should be sold, frankly, as a privilege. You have the privilege of treating my body, the only body I have. You have the privilege of being my voice, the only voice I have. And so how are you going to care for that privilege? Are you going to treat me like I'm a widget and you're running a factory and you're just going to push me through because maybe you're burnt out and you're over whatever and you don't get paid enough and you have your own family issues that you're dealing with at home? I get it, right? We all get the bandwidth issue. But the reality is we kind of need to go back to patient-centered treatment and patient-centered representation and recognize the power that we have by virtue of the education that we have and the privilege it is to be able to provide the services that we provide. I want to make sure that we hear from the chief, and also I'd love to hear, Francisco, your perspective as well.
A couple of weeks ago, I was contacted by some folks to be part of a campaign on the shot. And what I stated was, well, I don't know if I'm going to get it myself. So I've been getting some information from a tribal member of ours who's a doctor in Atlanta. And he's gave me some, information that I can trust. And I took a chance and got the shot last Friday. And the campaign, what I was stating to people was, if we're the most at risk people, why aren't we first on the list? And that's the hesitancy of our people. Because if we're the most at risk and we're not the first on the list, then I can't understand, what the problem is when we continue to die. And that's why a lot of our people are saying, why should we take the vaccine when we might as well take our chances with the virus? And that's what's going on in our communities. So last Friday, I took the virus shot and I put it on Facebook for a reason, because the campaign folks wanted me to partner with Ed Kennedy Center. And to me, that's a good choice because they deal with Indigenous folks and our type of people. And my thing is that our DNA is similar, and that would be a good place for us to bring Indian country and partner in that community, not just for the vaccine, but for healthcare, period, through Indian healthcare services. So once that happened and I took the virus, I started getting some more appointments down there, and more people been kind of calling me because I guess I was the guinea pig. And, we started having dialogues, which is what was important, what the doctor was saying. And I just got a call from my mother, who had an appointment scheduled for 3 months, was supposed to go tomorrow, and they canceled her appointment from Reliance. But that goes to show you again, through the system, where she's an elder, Native, she should be having preference, being at most at risk, and they're canceling her appointment. So now I'm struggling again to say, the information that's put out here by the governor, by the healthcare providers in the community, that, that people that should be at the front of the line, not at the front of the line. And I know a lot of people that are doing cosmetic stuff on their face that got the shot, barbers that got the shot, and they're not the most at risk. So I think that when we're talking about the politicians and the governors and the healthcare top officials, they need to get their priorities straight, because the reason why you're going to have a lot of people turn around and say, well, I kind of trusted this right here, but you know what? The more you make me wait, I'm not getting that shot, because you're showing me that I'm not of value to you. And there might be something in that shot that you might want to give me the last part of the shots, and, we're getting the crumbs. And that's where you're going to lose a lot of people. And also you're going to lose a lot of people that are undocumented, so-called, because they don't trust the system, period. So, that's where we're at.
Absolutely.
I had one comment.
Here.
Just hearing folks, really, I want to share some solutions because so that way we don't focus on all the negative thoughts here. First, we really need to change the face of healthcare. And it starts with the hiring practices of these institutions. And so, but when I have conversations with our hiring practice teams, the excuse or what is always told is we don't have enough candidates of color to hire for these positions. But then again, I have a lot of friends who have their degrees and so forth, and I struggle with when I hear that. So really pushing folks of our of color to, or even support young people to achieve their education, but it takes a lot of support, even mental support for our people, for our kids of color, our young people of color. It's going to take more than just, it just takes a whole village to really advocate for our young people to get access to a better education. And I say better education because the school even has achievement gaps. There's just so many gaps for individuals of color. But really our hiring practices is another area that we need to look at, supporting our young people of color so that way they could get into these systems, because that's the only way we're gonna really see change is by representing the communities that we do serve. Like I heard Dr. Tony, I can't pronounce her last name, I'm sorry. But even hearing her, how she practices with her patients, is just, it's just a testament to her background. She talked about how she's Haitian, she understands the different culture. So we need more providers that understand cultures and are sensitive, and to Chelsea's point, that we practice cultural humility. And the only way we're going to make changes if we have those folks in these institutions to advocate and push and use our own privilege to make these changes.
That's right. That's right. So really, I really think hiring is, I feel like people don't realize that the minute someone walks into your door, you are stuck with them. So if you don't do a good enough job screening and making sure that you ask all the right questions, you can provide them all the training you want. The reality is you're stuck. As long as they do the bare minimum of their job, you're stuck. So you need to make sure that whoever you're bringing in your doors is not only cognizant of these issues. Ideally, you actively seek diverse candidates, but you also want to make sure that they are people who actually believe in these value systems, and you're not settling, right? Francisco, I want to make sure that you chime in here as well. Oh, I think you're on mute.
We've been talking for an hour and a half about all the problems and ways of discrimination and so on. I agree with Rosa that we need to talk a little bit about solutions. And I think that one of the solutions to this riddle is community education. We need to go to the community and we need to educate the community. One of the things that happen out there is that many of these healthcare systems that we complain so much about, are treating the community and relating to the community with public monies. It's not even monies from their own pockets. It's the monies that we pay as taxpayers. And they receive these big monies from the government, and then they turn around and discriminate against the very same people that are paying taxes for their operations. But unfortunately, our communities don't know that. Our communities don't know, and they need to know that, they need to exercise power over their elected officials, and they need to, indirectly exercise power over these institutions that way. The other thing that happens is that when our population, when minorities go into courtrooms, they don't choose the judges they see, but they do choose their doctors. And so they need to understand that if you find a doctor that is discriminating against you, you need to get rid of this doctor. And you need to talk to people that just so that if they get this doctor, they need to get rid of this doctor, and we need to start boycotting these doctors. Rosa said it, it's not individuals, it's the system, but you find individuals within the system that are not very helpful. And if you find an individual like that, you don't have to stand there and take it, right? You need to look for a better doctor. You need to find a doctor that you understand and that they understand you, and so on. All of that is community empowerment, and we need to put the time into building the community.
I love that. Thank you. And I think that's one of the things that New View does. There are so many organizations that work on educating us about how powerful we can be by just understanding the local system and holding our local politicians accountable, because most of them didn't necessarily go into local politics because they had kind of a grand scheme of things that they wanted to fix. And frankly, that's where you can kind of shake things up the most. So I really appreciate that. The last few minutes, I would love to talk about that empowerment. So what do you do when you see something? Talk to us about ways in which, if we observe discrimination happening because we happen to be in the office, or we hear about a family member or a friend who has been treated with disrespect, talk to us about some ways that we can become amazing allies and co-conspirators and obstruct the disrespect that we're seeing at the moment.
Sudi, can I take that one for a second?
Yes.
Because I think that's one of my call to action to white folks is, when you see something happening, say something. Even if you think there is no way that this person's ever going to change their mind, it doesn't even matter if the person who you're confronting changes their own manner or their own mind. What matters is that the other people who are around you see it, and that they see that happen. They understand that what is going on is wrong, and that you have recognized that it's wrong, and that you are saying something, and that they should be saying something. And it acknowledges that the person who is experiencing that wrong is not crazy, or that they are actually experiencing. It's validating, and it needs to be normalized that it's going to be called out when something is not right. So to just think that, like, well, maybe I don't have all the information, maybe I don't know what's going on, maybe she was rude, I don't know, maybe she didn't understand. Putting aside all of our like inconsequential fears of looking stupid and just calling things what they are is really powerful in changing, in culture shifting. And that's what needs to happen from a white allyship perspective.
Thank you so much. Chantal.
Hi, hello, thank you so much. I just wanted to kind of chime in and speak onto the question about empowerment. I'm not white, but I do work as a birth doula here in Central Massachusetts, And the work that I do is all centered around empowerment for women and birthing people who are trying to navigate through the healthcare system. And I would say, for me as a practicing doula, ways that I encourage birthing people, one is just to ask questions. You know, I think, you know, asking why, it sounds so simple, but that is one of the ways you can empower yourself to say, well, why? Why are you prescribing this? Why are you treating me this way? Or just questioning can bring empowerment. I also think too that one way that we can empower the marginalized is to also just speak our truth and tell our story. You know, speaking up when something has gone wrong and when something has gone right, right? And not to be afraid to tell what is true to you. I feel disrespected, you know, I feel, you know, having those I statements and letting your voice be heard, that's empowering. I also would say, you know, as a birth doula, I encourage, you know, the folks that I work with to trust their body, you know, and trust their own intuition. You know, in healthcare, especially in maternal health, there's this idea that, you know, the doctor knows best. You know, they're the ones that have the education, the experience. But at the end of the day, you know, as a birthing person, I have lived experience, or, you know, they have lived experience. They know their bodies better than anyone. They've lived in their bodies longer than anyone. So to trust your body, if we can encourage, you know, people of color and our Indigenous brothers and sisters to trust their bodies, that is empowering. So yes, I would say those are some definite ways to empower others. And if you are working in health and maternal health, I have to highlight, underscore, italicize, get a doula. Get a doula. Just by having a person standing in the room reduces negative outcomes, period. Just by standing in the room. Yeah. So the evidence is just so clear that, you know, the presence of a doula reduces negative outcomes, reduces unnecessary medical interventions, reduces or increases in our positive birth experience. And birth, and I think justice and equality, it starts in the womb. You know, this is ground zero, you know, for advocacy work.
I love that. I love that. So powerful. I want to make sure before I wrap up, is there anyone else that wants to chime in?
I wanted to
go ahead, sister.
So I'm under the chief Buffalo Spring. I'm under him, but I wanted to share when we were having a conversation about the stories that we were sharing, and it was perceived as negative or complaining. I just wanted to bring that back into our noticing and listening, because that's oppressive and that's subjugative, in the sense that we got to tell these stories so that we can identify the problem, so that we can find solutions. And it's going to take time. And yes, I sit on many boards, commissions, councils, and committees because of these stories, to affect and interrupt the narrative and the systems, right? I sit there. So that's what I do. So it's not just, it's not a complaint. It's my story. It's my history, and it's valid. And even though it may appear to look negative, it is. It almost cost my daughter her life. It killed Dr. Tony's father. Like this is not just a feeling or a sensation. So I just want us to think about that, because this is part of the systems. And
She froze.
I just was reflecting on that because I kept hearing this narrative, and I was like, hey, we get to shut that down with our conversations, right? And I love your baby. Hi, Dr. Tony's baby. And so that's all I wanted to say. And the way that we can interrupt these narratives is by finding out where do we go. And then like people call me all the time. Who do I talk to in the hospital? This happened to me. Who do I talk to with the doctor? I hate this doctor. I've been with him 20 years. I don't know what to do. So going back to Francisco's point, people don't know that they can choose a different doctor most times. They think that's it. And you know what? A lot of our people of color think, oh, at least I have a doctor.
That's right. That's right. I think that is such a powerful point. I know I want to make sure, Chief, that you chime in as well.
So I just want to say that that when Sister Irene says she's under me, she's an adopted member of the Wachusett or Wampanoag tribe of the Pokanoket Nation as a Taino sister. And that's how I educate people. And that's why my daughter's sitting here as well, is that I empower people as a chief to educate them on their rights in the community and their rights to health care through the federal government and the state. And I'll give you an example. One day I was at CVS Pharmacy, and they asked me for identification. And I gave them my tribal card. And the woman there said, I can't take this tribal card. And I said, you sure can take that tribal card because you asked me for identification. And I don't use a license because I'm not traveling and it's not commerce. I use my identification card. So even if a police officer asks me for identification, I give him my tribal card because it has on who I identify as Sequin Pajeke as well as Spring Buffalo. So when she said, oh, I can't take that, I said, well, okay, I'm going to come back. I'm not going to take my medication. So I called corporate and I looked up their policy for diversity. And what they said was, oh, we're going to work with all groups and we want to do this. So I asked for their diversity officer and I asked for their CEO. So when I spoke to them and let them know that they need to look at the cultural aspect of when you're talking to indigenous people, I'm not coming in there under your conditions when you're talking about identity. I'm coming in there under my conditions because it's my medication, it's my money, it's my service that you're offering. And if you're offering a service to people, not just one individual people, but people, then you're going to abide by my rules and my people's rules. And if I'm having a problem as a chief, then you need to work this out with all people that come in there because they're getting shut down. So what she did was CEO called me back the next day and we had a meeting to say, oh, that's in our policy. You can use that identification. Of course you can do that. And I'm going to send it out across all the CVSs around the country and even in Puerto Rico, which I didn't know that they have. Okay. To make that a policy that you shouldn't be discriminating against such and such. Because just like you have a clientele that comes in your store, you have an indigenous population that comes in your store and has to be friendly. So going back to what Francisco stated about communicating and touching base with your community, you have to have people in your community that's going to empower you to be empowered, to go to them and say, I don't think so. I'm going to go back to Chief Spring Buffalo and he's going to say such and such and such because I can use my identification card at the bank, which I haven't. I can use it at the DMW. I can use it anywhere because it says identity. Give me some proof of identity. And that's what it's all about. But if you don't know, and I didn't get mad at CVS because their people didn't know. You have to educate your people to what you're saying at the top. Exactly. And if you don't do that, then they're not going to know. And I can't get mad at them. Oh, I got mad at them because I needed my medication, but but I took it further. So thank you.
Thank you. Rosa.
One last thing. I know we're not gonna solve all these problems overnight, and that will take actually deep commitment. to rise up to this enormous challenge. Only together we're going to be able to address these concerns with equitable lens and with dignity and respect. I want to mention that we need to include our people of color and indigenous folks around these tables so they have a safe space to speak up and be reflective of the values inherited in their feedback. So we have to create some safe spaces for these individuals to be heard. And so back to Irene's point, when we hear these concerns, we could find some solutions. Since we're talking about healthcare systems, we should try to educate our folks about their patients' rights. There are rights written for them so they could advocate for themselves and know that they have rights too. Every healthcare system is required to have a PFAC, which is a Patient Family Advisory Council, which is another entity where community members could sit around the table and hold hospitals and health leaders accountable for their practices. So I encourage folks to invite more people of color to sit around those tables, to hold our healthcare systems or any other system accountable and have these healthcare systems be transparent about their policies and their procedures. So I co-chair our PFAC at the hospital. So I opened the invitation to anyone who might want to join a PFAC. We are delighted to hear the voices of the community. We also just recently formed a group in the hospital called Minority Advisory Council. And it's only for diverse individuals, whether it's a caregiver inside the hospital, because sometimes our people of color within our healthcare system also need encouragement, and they also need support. And because again, microaggression, they're the ones who are last heard, less opportunity for growth, and so forth. So we've created a space for caregivers and community members, and I'm proud to say that Francisco and Irene are both MAC members. And so they give concrete solutions or how to better improve a system that's broken. So really it's the voices of the people, the voiceless, that could really make those changes, because they're the ones who are being affected by it. So they're the ones who could really share better experiences of how to solve these issues. So that's it. PFAC, MAC, I welcome anyone.
And frankly, we're going to provide this video so everyone can reflect on this, but also I'll connect everyone on here through email so that everyone can utilize this as a resource to kind of broaden your network. I've been reading a lot about interventions, and historically they were used with respect to physical assaults or domestic violence or harassment in workplace settings. And now, as our communities are becoming more and more aware of microaggressions and how important it is to see something, say something, even in the realm of death by 1,000 cuts, verbal damage. I was reading about Brock Turner, and I don't know, I'm sure you've all heard about the case. It was the young man who was sexually assaulting a woman behind a dumpster, and two young men on bicycles were riding by and were able to intervene. But for them driving by, who knows what would have happened to that young woman. But the thing that was really powerful is that she gave a statement in court during his sentencing. And it really kind of touched me. She said, I still haven't met those two men on a bicycle that intervened on my behalf, but above my bed, I have a picture of two bicycles. And every night before I go to bed, sorry, I get emotional when I think about it. Every night when I go to bed, I think I had 2 guardian angels that were overlooking and watching out for me. And so I really believe when I see all of you and when we have this conversation that each of us are soul food for each other to function and to be able to get over some of the hardest parts of kind of the sadness and the ugliness we can see. And really, if we get band together and we stand up for everything that we see and utilize each other as support systems, that we really can make a difference in our communities. And it really starts one person at a time. And I'm so honored that you all gave your time to be with us tonight. And I promise you that this is just the beginning of many conversations to come. And we will make sure that these conversations are available for people to watch. And we're going to encourage them to watch. But please know that you have certainly made a difference tonight, and you're going to make a difference moving forward, and we collectively are going to make a difference. So thank you so very much.